We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
As of July 10, 2021, the Philippines had over 5,000 new infections reported on average each day. They have administered enough vaccines to have vaccinated just less than 6% of the country's population. Compared to the US, almost 60% are fully vaccinated here. US President Joe Biden had committed to share 80 million US-made vaccines with countries around the world, including the Philippines, who was part of the first 25 million doses donated by the US. Filipino-American leaders of registered nurses, doctors, and community advocates talked to US Senator Chuck Schumer during a Memorial Weekend virtual meeting and requested an allocation of 5 million COVID vaccine doses for the Philippines. One of those groups was Frontliners Above and Beyond, also known as FAB, who lobbied for more vaccines from the US to the Philippines. So this episode is the first time we will be taping hybrid, with half of us in person at our main studio at Manhattan Neighborhood Network and half on Zoom, including our founder Cristina Pastor, who is joining us from Beijing. So welcome everyone. I am Rachelle Ocampo and joined with my co-host Jen Fuhrer in person, and let's get to know our two special guests. We have two members of FAB joining us for this episode to share what their group does and help debunk some myths and misconceptions about the COVID-19 vaccines. So first we have Dr. Lee Castaneda, who is currently a pulmonary critical care doctor at a leading hospital enterprise in New York City, which was one of the hardest hit COVID hospitals in New York in 2020. His team was integral in managing upwards of 7 overflow intensive care units filled with critically ill COVID patients. And his hospital on the whole has seen thousands of COVID patients. We also have joining us virtually Miss Ellaine Laureta, who is a registered nurse currently serving in a minority community on Long Island, New York. Throughout the pandemic, she played an integral role in her nursing department's COVID-19 response through acting as a resource person and providing health education, preliminary guidance, and assistance to families affected by COVID-19. So welcome Dr. Christian and Ellaine for joining us for this really memorable episode. My first question to both of you is, can you tell us a little bit more about Frontliners Above and Beyond, and how did you two get involved?
Thank you for having us.
Yeah.
So Frontliners Above and Beyond was sort of the brainchild of one of the nurses at our hospital, Kimberly Villemer. So she was really the founding member of it, and I'm a pretty good friend with her and have worked closely with her for the past 6 years in a clinical setting. So I think that's how I got involved. And she's very, very active and a big advocate for safety and education with regards to COVID-19.
Nice. And yeah, and Ellaine.
So Frontliners Above and Beyond is a community of professionals who voluntarily take their skills, talents, and leadership capacities beyond the workplace to do good and make a difference in society. So like Dr. Christian said, our founder, Kim, she actually put out a call to see if anyone wanted to join this organization that she wanted to create. So that's how I became involved. I was one of the members who responded to that call. And we are joined with some truly talented and accomplished people in this endeavor.
Nice. And Cristina, I know that you had a question, right?
Yeah, I'm curious about the role of Frontliners Above and Beyond. How did you get involved in this effort to secure vaccines for the Philippines? I wanted to know how that came about.
Ellaine, maybe you want to take that one?
So Frontliners Above and Beyond was at the forefront of a consortium of Filipino-American organizations that lobbied for more vaccines to be sent to the Philippines. So together with other Phil-Am leaders, we were able to meet with US Senate Majority Leader Chuck Schumer and gain his support in sending an additional 5 million AstraZeneca vaccines to the Philippines. And this was very exciting because it is on top of the already allocated 45 million vaccines through COVAX.
So the Philippines is going to get 5 million vaccines. Is that
we had, come again?
Right now we have gotten, I mean, the Philippines has gotten something like 2.5 million, right?
I'm not 100% sure on the current statistics. I do know.
That's a statement I got from the US Embassy. I think 2.5 million has been allocated to the Philippines, and I think it has been shipped. So does that mean another 2.5 million is coming?
Well, at this time, we were notified that the letter from Senator Schumer did indeed go to President Biden. We are still waiting for confirmation on if this request was granted. However, there was a recent news about a shipment of 3 million Johnson & Johnson vaccines that were sent. We're still trying to find out if this is related to the lobbying efforts of FAB together with other PhilAm organizations in the meeting with Senator Schumer, but we'll keep you updated on that.
I think every vaccine that gets to the Philippines is a good cause. I mean, so you guys talk about Salamat Bakuna USA. What does that mean, and what's your goal?
I think the most important part of that is that literally exactly what you just said, every vaccine that gets there is not only probably just one life saved, but it's like multiple lives saved, because that prevents it from spreading to someone else. So I think that's the entity behind that, and or like the meaning behind that.
And so I like the message that the group is sharing, and it's really a collaborative effort. It's not just FAB, it's not just the Philippine Embassy, it's all these groups of frontliners and community advocates that are really pushing for Philippines to really get the resources that they need, especially if we have the capacity to provide. So I think the main message is, if they're not going to know that Philippines is in need if we don't tell them where the need is.
Yeah, I have family members who are in Parañaque who I know got their second dose already. But I have family members in Quezon City still having a hard time trying to figure out how to register. I mean, does your organization help Filipinos in the Philippines to figure out how to register for vaccine? Is it online? You have to knock on the door? I mean, what's the logistics?
I think a lot of our effort from our organization has been educating here in the United States.
Okay.
I'm not sure, Ellaine, do you know anything about efforts in the Philippines itself?
Yeah, so we do have FAB members and colleagues who are like doctors, nurses in the Philippines. So there are boots on the ground. They give us updates and let us know what's going on about the situation back in the Philippines. So as for the vaccination rollout, there's some similarities to what we had initially here in the US. There is a requirement that they have to register online. There's a due process. They become part of a master list of their local government unit. They do have a priority list as well. So that dictates the eligibility of an individual who gets vaccinated. When that person does become eligible, then they would be able to schedule an appointment and go to a certain vaccination site. From there, they would, just like we have here, find out what vaccine they get, register. They go through a pre-assessment screening, health education, get the vaccine, and then get that observation. Once everything is all set, they're medically cleared, then they're on their way.
So Christian, the Delta variant, how deadly is it? What are you trying to, how do you educate the community about the dangers of this new virus?
Very excellent question, Ms. Cristina. I think a lot with this Delta variant emerging, and admittedly I'm not a virologist, okay, I'm like a clinical doctor who works a lot with in the hospital with very, very sick patients, but a lot of data is emerging about it, so it's sort of hard to tell exactly how deadly or how more transmissible, but the idea is that as the virus continues to mutate and evolve, it might be a little bit more transmissible, it might be a bit more deadly, but it's sort of hard to tell. But the good news is it seems like a lot of the vaccines are effective against it.
So did you just say that if you're vaccinated, you have a protection against the Delta variant?
It varies between vaccines, but some of the preliminary data from Pfizer and AstraZeneca and some of the other companies, it needs to be validated in bigger studies, but they're saying that yes, like up to 96% efficacy against Delta.
I mean, that's already a win already. I mean,
Yes.
just having the vaccine is already protecting you not just from the original form, but also variants, which is a huge deal.
I mean, it has like a 90% efficacy rate, right? So, and which is a great thing. But there are people who are concerned about the mRNAs. I mean, there's no long medical history. So what do you tell those people? It's still kind of like iffy. Well, should I get the vaccine? We don't want this thing in our body. What do you tell them?
Also a very, very good question, because I think when this all came out like in December of 2020, so pretty recently, and everyone was a little hesitant, everyone was a little scared, even people inside the hospital, like the nurses, some of my friends who are doctors, they were like, oh, I don't know,
Yes.
like they've never delivered a vaccine like this. But I think the most important thing to realize is that it isn't, even though it's the first time, or not the first time, but it's a new delivery system for this type of vaccine. This type of research has been going on with mRNA for 20 plus years. And then the safety data now, we're approaching almost a year, because that study was published in December, but it had been running many months prior to December. So it is appearing to be very, very safe, and that's like amongst populations of like 40,000 patients.
And Ellaine, you also do a lot of vaccination education. What has been one of the hesitancy that you've seen in terms of the patients that you work with about getting vaccines?
So I'm actually based in the community. So one of the things that our focus is on disease prevention, and that's where that health education comes in. So I think a lot of hesitancy comes with the unknown. This is the first time we are having to deal with COVID-19. So this is the first time we're really rolling out this particular set of treatments and everything, and they're just concerned that down the line, how will it affect them? How will COVID infections affect them? And if they do opt for the vaccines, what are the long-term side effects of that?
I think that's a
Would
good.
you have information? Would you have information in the Philippines, Ellaine or Christian, on why there is a low vaccination rate? Is it because of hesitancy, or is it because vaccines are not available?
I believe that is a multifaceted, problem that's going on in the Philippines. From our colleagues who are there giving us feedback about what's truly going on, we see that there is a lot of vaccine hesitation still. And on top of that, there is a shortage of vaccines. We had received word from one of our FAB members, who's a doctor practicing in the National Capital Region, who said that a few weeks ago, they actually had to put a pause on the administration of first dose vaccines, just so that they could prioritize the administration of second vaccines to those who were scheduled. But there has been a sudden rush of vaccines to the Philippines at this time, so that they are able to kickstart it back up. But that's definitely one issue that they're dealing with.
My 20-year-old got COVID, a really severe case. He still has that they call COVID cough. He got vaccinated, fully vaccinated, because we were concerned for the other members of the family. But at the same time, I'm concerned as a mom, because he's a young man, and putting this vaccine, which he already had the antibodies. So what can you tell other people, maybe even in the Philippines, who already got COVID, and then kind of like, I don't know if I should get the vaccine?
Also, very excellent question. So when people come ask me that question, it's weighing sort of the benefits and the risks of both things, right? So with the COVID infection, and I'm sorry that your son got COVID, but with the COVID infection, there's a known real risk of like damage to the lung in the long term, right? That you could theoretically damage your lung and like be functionally limited for the rest of your life. Whereas for the vaccine, you are protecting yourself, the rest of your family, and possibly there is a little bit of unknown. I understand that, but the risks much outweigh, or the benefits much outweigh the risks in that situation, where the corollary is possible lung damage, permanent lung damage. So why wouldn't you try to prevent that?
But are they doing studies to see if there are long-lasting effects for those who already got COVID and get 2 doses of Pfizer and see, not that I don't know if it would help anybody, but at least peace of mind, or?
Who already got COVID and then got 2 doses of Pfizer? I'm not sure about that, to be honest with you. Yeah, I'm not sure.
Well, what happens actually if you miss your second dose?
So if you miss the second, the level of protection you have is just a little bit lower. So obviously everyone should get a first dose or both doses.
Yes.
But I think that rate, the second dose rate, is actually falling in New York. It's it used to be closer to 92, 93%, but now it's falling closer to 90%.
Oh.
So people aren't going for their second dose, but
Oh
it's
my
important
gosh.
because there's only an X amount of efficacy with 1 dose, but the studies have shown efficacy to 90% with 2 doses.
Well, I think that's why it's so important that the Philippines actually just got that promise of Johnson & Johnson, because it is only 1 shot.
Exactly.
So there's you don't have to logistically have to prepare for the second shot. What are some of the myths that you've seen, the most popular myths, and how would you be able to debunk them?
It's a hard question. We just had a very, very long talk on it, but I think just briefly, 3 of the most common myths that we get are: 1, exactly what you were just saying, Ms. Jen. Will this affect my fertility in the future? Will I be able to have children?
People actually say you're going to die in 2025, but that's very bad.
But the vaccines have been studied in very large, well-designed trials to be safe. There's no, according to CDC.gov, and people much smarter than I am, that there's no effect on fertility. And even,
all right, I'm going to be a grandma in 20 years.
And then there's also a very large proportion of people who have gotten pregnant after they got the vaccine already. So New England Journal, just 2 months ago, published pregnant patients who got the vaccine are okay, they're turning out okay.
And Alex is fine after being breastfed, after having vaccines and the antibodies. He's doing fine. I mean, it's really. I think we need to share those positive stories and facts that it doesn't affect fertility. We'll be able to have more babies. I'm planning to have more babies after this. I'll
made an announcement.
No, not an announcement. But yeah.
An announcement.
I know. So that's one.
How do you? Oh,
Go ahead, Chris.
Go ahead.
Okay.
I guess, Christian, how do you talk to people who are reluctant to get the vaccine for political reasons?
For political reasons.
Like what reasons are political?
Like it has been compared to Nazi tactics by some politicians.
Oh.
Right? We've read about that in the news. So how do you address those kinds of resistance?
I think the most important thing to remember is, even though it was only a year ago, people are already starting to forget what New York was like even just a year ago. And then people have part of the reason why I try to help is because people don't realize what it was like inside the hospitals about a year ago. It was actually it was unreal. It was a different world, almost like a war zone, where we were just being inundated with hundreds and hundreds of COVID patients, and there was just so much death and destruction. And thankfully, a lot of people here in New York, they stayed at home and they tried to stay safe. But what we saw in the hospital with 30, 40-year-olds dying, things like that, no one should ever have to see that, and no one should ever have to experience that. No mom should ever have to bury their son, sort of thing.
You guys mentioned about health education. Is there a way, health-wise, you could do to help protect yourself from being sick? Like taking vitamins, or is there such a thing, or nothing can help you from being sick?
I think practicing, especially if you're not vaccinated, which you should get vaccinated, wearing your mask, washing your hands, basic hygiene is the key. Even before the pandemic, flu prevention techniques, just washing your hands all the time. Thankfully, that's gotten a lot better now since the pandemic, just general hygiene. But I think that's the most important thing.
What is the Filipino-American community's reaction to the vaccine overall?
I Yeah, no, I think just in here in US, Cristina, we keep forgetting that you're in Beijing. So in in New York, I feel that most of Filipino-Americans have been getting their vaccine, and it is really because of their family and their jobs as well, just to go back to normalcy. But one factor in terms of what makes the Filipino-American community different from others is that we live in multi-generational homes. So when we have nurses and doctors in like treating COVID patients, you come home, you really want to make sure that you're protecting yourself and your family members. So it really is a huge burden on the family if you're not vaccinated.
And the number of cases that we saw in the ICU where like a young person maybe goes to a party, like when the first wave was coming down a little bit, a young person comes to a party, enjoys a little bit, then comes home and then gives it to the mom or the dad, who then gets very, very sick. That's the worst, because the young person, or like the son or the daughter, feels guilty for making and then no one wants that. No one wants to hurt their family.
Yeah. And so you mentioned the first myth of fertility. What are the other two that you've seen?
I think the number 2 one that I always get asked is that it affects your DNA, and it physically does not enter the area of the cells where our DNA is stored, so it's physically impossible for it to affect our DNA. The AstraZeneca one does enter the area, but it lacks the machinery to change our DNA. So it just uses our cells to manufacture the antigen that then builds up the immunity in our body. So definitely does not affect our DNA in any way, shape, or form, even though it sounds scary because you're injecting genetic material into your body. Yeah.
Okay.
I know someone who's really sick who got the Moderna, and then like way back in the beginning, and then the doctor told him that if he wants, he could also get Pfizer in like maybe in 8 months or something, because he's really like susceptible. If he gets sick, if he gets COVID, it's really bad for him. So they suggested to get Pfizer. Is that advisable? You already got Moderna and not getting Pfizer.
Very, very, very good question. So right now there's no recommendation. You shouldn't mix the two. Like if you get a first shot Pfizer, you shouldn't get a second shot Moderna.
Well, he already got 2 shots of Moderna, and then.
So for that particular, there are special populations. Like you said, your friend is very, very sick. So in very like immunocompromised people who have like transplants or things like that, they are like a special population that are there are studies ongoing for those we call like very, very susceptible people. There's no official recommendations for those yet, at least as of a couple weeks ago, to my understanding. But for like regular, relatively healthy people, shouldn't like you don't need to get a second vaccine. Yeah.
I think the main message is make sure you consult with your doctor, because they know your history and what is best for you. Yeah. And then go ahead, Cristina.
Go ahead. Do you see COVID becoming normalized like the flu? Whoever wants to answer.
Excellent question. It's hard to tell. It's definitely possible, right? So I think a lot of epidemiologists are thinking that it's possible, but it's not really showing like the seasonality. So like we had a lot of COVID during the summer last year, whereas the flu is very clearly seasonal. But once again, I'm not an epidemiologist, but I guess it's possible.
Maybe that's why they're thinking of getting booster shots in the future. I mean, it's not there yet, but I mean, as we said earlier, I mean, it's a new disease, even though it's like almost a year, 2 years now, but we still don't know.
Yeah. And then
so Cristina, you've been vaccinated. Do you still wear a mask?
Yes, ma'am. I try to, especially just to protect the people around me.
Great.
The official CDC is that if you've been vaccinated, there's like a lot of situations where you don't need to wear a mask. But the problem is that you don't really know who's been vaccinated, and at the end of the day, it's like I don't want to unknowingly hurt someone else that I'm just like walking next to on the street. Yeah.
And Ellaine, how about you? Do you still wear your mask?
Yes, I still wear my mask, although I'm fully vaccinated. Going back to what you said about Filipino culture and us always being family-centered and not wanting to bring anything home to our families or to other people, for that matter, when dealing with COVID. So yes, we still do.
Maybe that's the difference between suburban and urban. I mean, in my town, if you're vaccinated, most people, I mean, when I'm walking in my town, we don't wear masks. When you go to a restaurant, we're not wearing masks. When I went to the city, just getting on the train and the station, and even walking outside, you see people still wearing masks.
Yeah, it's definitely different in terms of situation, environment, and who you're with and who you're comfortable with. It's about your risk, like how much are you willing to risk when you're out there. So we are running out of time already, and I wanted to just pitch in just one last question is, what is one message that you want to provide our audience?
I think the most important thing is, actually I really like the COVAX motto is that no one's safe until everyone's safe, right? So I think that's very poignant. So make sure you get vaccinated, and if you don't want to get vaccinated for yourself, get vaccinated for the people around you and your family and the people you love.
Love that. Okay, and Ellaine, your message.
And as for me, especially for those people who are still on the fence about getting vaccinated, is to really seek accurate information, vaccine education through reliable sources in order to make that decision with your medical provider. That's it.
Great. No, thank you so much for joining us. And I love your shirts. Where can we get them? So make sure that everyone knows that I'm vaccinated.
You can get them at icuconsult.org. It's we try to donate proceeds to good foundations and charities and things like that. And I brought some for you guys. So
awesome. Okay. Nice. All right. So we'll definitely share that on our Facebook and our audience. Thank you again for everyone joining us on Makilala TV. I really hope that you get some helpful information from Dr. Christian and Ellaine. Thank you so much for joining us. And thank you for all your support on Frontliners Above and Beyond. Cristina, we're missing you here in Manhattan. And Jen, thank you. And Jen, thank you again for coming by. So again, maraming salamat and sa ulitin.